Tomorrow, the Supreme Court will be confronted once again with the issue of abortion, with justices hearing arguments over mifepristone, right? That's the abortion pill, as it's often called, one of two pills used in the most common kind of abortion in the country. At the center of this case, did the FDA overlook some serious safety issues when it made mifepristone easier to get, including through the mail? In a piece just out late tonight here on NBCNews.com, patient advocates and doctors now say they're worried about the potential that a dangerous precedent could be set. One OBGYN tells us restricting access could mean that most people trying to get an abortion will be affected. Berkeley Lovelace is reporting that out. He is joining us now. We're glad to have you here, Berkeley. One of the experts that you talked to called this a uniquely important case. You could argue any case that makes it to the level of the Supreme Court is important, but why is this one so unique?
Yeah, so as we previously reported, medication abortion makes up nearly 2/3 of all abortions in the United States. And this number has been steadily rising since it was approved in 2000. And so what the Supreme Court could essentially do is roll back many of the things that the FDA has done to make this drug easier to get and easier to dispense. So that means getting it by mail, not having to go into a doctor's office to visit, many of these things that make it much easier to get. And so this could hugely limit access. And so we've already seen what this happens with states that have banned medication abortion. So at least 14 states have already completely banned medication abortion. And we've seen with reports that people are essentially crossing state lines in order to get access to abortion care.
Well, the FDA says medication abortion is safe and effective, and a lot of doctors say it's their preference as well. So what is the prep then for the potential for restrictions? And to be clear, we don't know what the Supreme Court's going to decide tomorrow. Tomorrow is just the oral arguments.
Right.
We won't know any decision until later on in the term.
Right. So experts are predicting it could be a decision, a final ruling could be sometime at the end of June. And so doctors are particularly concerned about their patients. We've heard about doctors concerned about patients with disabilities who may not be able to travel to get a medication or who live too far away from a clinic, who may not be able to get access to the medication. And so what I've heard is that doctors are essentially stocking up on the medication in case there's a limit to access. I've also heard of doctors just preparing to do one medication, misoprostol. It's one of the drugs used in medication abortion. And so that's still effective, but sometimes you have to take more of the medication as well, which can come with unpleasant side effects. And so doctors are thinking about that as well and talking about their patients with that. And so there's a lot of preparation going on for this potential scenario.
And just really quick before I let you go, there is also potentially a broader implication that goes beyond simply abortion access.
Right.
And that is, you know, the argument that is being made. Did the FDA mess up by even approving it in the first place? And could that then put into the spotlight every other medication that the FDA approves?
So this is potentially going to affect FDA's authority on medications. And so there's fears that this could, potentially impact other future approvals in the future.
If it were some sort of sweeping ruling.
Correct.
We'll find out, I guess, in a few months. And the oral arguments tomorrow. Berkeley, good to see you. Thank you.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.